Hello, everybody. Is this working? Yes, I think so. Hi, everyone. So, this is Dr. D, aka Dr. Degha Fongod. I wanted to go live today because um, I did a few treatments in the office today for laser hair removal. And again, I keep getting the same questions about laser for darker skin on social media. So, before I relax for the day, I wanted to come on here and just do a quick chat about laser hair removal in people who have darker skin tones. So, to start, laser is basically like a machine, and that machine creates a wavelength of light, and that light is targeting pigment. In this case, we wanted to target pigment in the hair follicle. Okay. And so when a lot of people come in for laser, there's always this concern that, we have darker skin tones, so is laser safe for us? And the answer is yes, depending on what setting is done and what type of laser or what wavelength is used. So if you have darker skin, so I have darker skin, or patients who have brown skin, black skin, usually we recommend that you use an ND-YAG laser. So the wavelength is 1064 nanometers, ND-YAG laser. And the reason why we love that particular laser is because the light can penetrate through the skin into the root of the hair. So it will ignore the pigment on the surface of the skin, but it will go deeper. There are other lasers like a diode laser, which is also another option for darker skin tones. But one of the issues with the diode is as we do more treatments, we need to increase the power of the machine. And so once you increase the power of the diode, it can get dicey and it can lead to burns. The other option is an alexandrite. That is not an option for patients who have darker skin tone. Okay. And IPL is absolutely a no-no. I can do a whole nother video on IPL, why people of color shouldn't use IPL, especially for hair removal. So all the home laser hair removal devices are not a great option for people who have darker skin. Okay, so let's just put that out there. So if you're coming in for a consultation, typically we'll talk about what laser is, and then we'll talk about like what area we're treating. So if, for example, you're coming in because you have hair on your chin, so facial hair, usually that hair is caused by hormones, right? Hormones make women have facial hair, thick facial hair. And so we will talk about the fact that if it's a hormonal issue, laser or the hair is a secondary effect of the hormonal issue. So the laser can help because what it's going to do is that in the first two treatments, it's going to make the hair go from thick to thin. Okay. And we want that because the thick hair usually is what causes bumps, ingrown hairs, irritation, and then that leads to hyperpigmentation, right? So the first goal is to get the hair to go from thick to thin. Once the hair becomes thin, then it's much harder to get rid of the hair because it doesn't have as much pigment in it. So that's when we usually increase the power of the machine. And when we increase the power of the machine, that's where people end up with potential burns. And not all NDEAGs are created equal, but this is where people can have problems when they're doing treatment number 4, 5, 6, where now we're trying to get rid of the thin hair, and then you find that some people potentially could get burned. I reacted to a video like that today where somebody had been doing laser treatments without issues, and then they up the power and boom, they got a laser burn. So that's really important to understand. And the other thing is if it's hormonally driven hair, it will take much longer to get rid of it because again, there's a hormone that's pushing the hair to grow. And so in your face, your underarms and your Brazilian area, the hair in those areas tend to be hormonally driven. So it will take longer to get rid of the hair. And if you're not diligent and consistent with the treatment, the hair will come back. Now, it might come back fine. So it's not going to cause ingrowns anymore, but it will come back. So that's important to know. Okay. And so we usually will do the treatment for the face. It's every 4 weeks in the beginning. And then we may make it longer depending on how your body is responding to the laser. And then for the body, it's like every 6 to 8 weeks. You want to make sure that you shave prior to coming in, because if you don't shave and we do the treatment, it is going to hurt. Because the laser is going to focus on the hair at the surface of the skin, and it's going to burn it. And that burn is going to feel painful versus if it's focusing on the hair underneath the skin, it's not as abrasive. So, really important to shave. When we do the treatment, sometimes you will get some redness and swelling after the treatment. That's very normal. We usually use aloe in the area. But if you go home and you find that the skin is super irritated, then I would say use a hydrocortisone cream. If it doesn't get better after a few days, call your doctor or your practitioner. Okay. So those are just a few things. Another really important thing that people mess up with laser is that they don't realize that medications that they're taking can affect laser. So you can't be on Accutane, you can't be on antibiotics. You just need to disclose whatever medication you're on, because some of them make you sensitive to light. And so, if we do laser while you're on these medications, you will get hyperpigmentation, or you could get burns from it, and that could be a problem. But for the most part, I would say that people who have darker skin, in a way, they have an advantage, because the only the only issue that they have is the fact that the hair is curly and dark. And then if we do treatments consistently over a period of 1 to 2 years, they usually get good results. If you're somebody who has brown skin, for example, patients of Asian descent, or patients who are a combination of like black and Asian or black and white, mixed race, I don't even know if that's the right word, but mixed ethnic groups, they tend to have different mix or different types of hair. And so for them, laser hair removal is actually quite tricky. But if you're black and you have dark skin and you can find someone who has a reputable ND laser, it's going to be the best option for you. Now, another mistake that I see people make is that they go to a laser place and they're told 6 treatments is enough. No, in my experience, at least, I don't think 6 treatments is enough. I always tell patients 6 treatments may be enough for the first year, but you need to come back for another year, and you could potentially get 4 treatments. And then the third year, you might need two. But 6 treatments is never enough, at least in my experience with the laser that I have. So when you go in for laser, just know that this is going to take some time. It's spaced out between 6 to 8 weeks if it's on the body area. So just know that it's going to take some time in terms of the commitment. Obviously, very important to make sure that if you're doing laser, you minimize or eliminate sun exposure. So in the summertime, if you're going to be doing laser, most of the time we just tell you to wait till fall or winter to do your treatments. But bottom line is that look for somebody who has an ND-YAG laser. That's the safest option. Now, there are different types of ND-YAGs. Some have more power than others. And so, as you do more and more treatments, you do run the risk of having a potential burn if they're not experienced. And so, you want to find somebody who has experience treating darker skin tones, who can handle complications if complications arise. And yeah, 1064 India, it's the one that I will suggest for everybody. I do know that not everybody in, well, not everybody in the States has an NDIAG, and I do have followers from all over the world. And so uh, 810 diode is another option, but just be cautious with it, because first couple of treatments usually will not be an issue. But if the power is increased, it can be tricky for people who have darker skin. So one way to go about that is just to have your practitioner keep you at lower settings. It might mean that you get treated for a longer period of time, but in my opinion, that is better than getting a burn. So just a little Friday night spiel about laser. If you guys like these, then I can try to go live every Friday. I think what I want to do is like kind of summarize my week in terms of like what I'm seeing in the office, and just answer questions that came up during my visits. And yeah, kind of be like a mini vlog of what my day looks like, or the cases that I saw, and my thoughts on the situation. But today was mainly like concerns with laser hair removal, so I figured I would talk about that. And I did a live today actually with Dennis. So hopefully I'll post that so you could see what the whole process of laser hair removal looks like on somebody who has darker skin. All right, I'm gonna end the live here, but this is my first time going live on YouTube, so we'll see how it looks. But if you have questions, just leave them below, and I will do a more dedicated video that will be more comprehensive on laser hair removal and all of that stuff. All right. I hope you have a good day. Bye.